Welcome everyone, and thank you for attending today's webinar with Fullscript and Nishi Bhopal. I'm Sarah Kunzer from Fullscript, and I'm so glad that you joined us today. Before we get into the presentation, I wanted to go through just some brief housekeeping. First, I wanted to remind everyone that this recording will be sent to everyone who registered. So if you have to leave early or would like to watch it again, you will have access directly from your inbox. The recording will also live on Fullscript's website, where you can access all of our past and upcoming webinars. Throughout this webinar, if you do have any questions, please add them to the Q&A box, and we will get to them during our live Q&A portion at the end. And with that being said, I'm going to pass it over to Nishi to take it away, and I will rejoin you closer to the end of the presentation for our Q&A.
All right, wonderful. Well, thank you everyone for joining today. I'm Dr. Nishi Bhopal. I'm an integrative psychiatrist and sleep doctor. Today, we're going to be talking about 5 sleep supplements to enhance your clinical practice. And as we get started, I'd love to invite you to share in the chat where you're joining me from and what your background is, what your specialty is. I'd love to just get a sense of who's joining us this morning. So let's go ahead and get started. So today, I am going to show you how you can shift from struggling to help your patients with sleep, from feeling overwhelmed with the variety of supplements and treatments that are available and feeling frustrated with poor patient outcomes, to transforming your patients' lives and enhancing your practice by learning the foundations of sleep medicine. And I see some comments: Santa Rosa, California. Oh, so we're neighbors. Arizona, Honolulu, Hawaii. Wonderful. So we've got people from all over. So a quick disclaimer: the information that I'm presenting today is information only and is not medical advice. I see some more responses all over the place. I saw Calgary in there. I'm Canadian originally, so welcome everyone. So I'd like to invite you to turn off all distractions. So put away your cell phone, close the tabs on your browser so you can get the most out of this presentation and focus. This time is just for you. And if you stay with me until the end of the class, and if you decide to work with me as you go on your sleep education journey, then I'll tell you about a special bonus that will be available at the end of today's class. Okay, so I'm all about clinical tools that make our practices easier, right? We're so busy, we're seeing clients or patients back to back. And so I like to figure out tools that are going to make things easier for me in my practice. So this is one that I like to use. If any of you are already using it, let me know in the chat. This is the Memorial Sloan Kettering Cancer Center About Herbs platform. And it's a free resource where you can look up different herbs, botanicals, you can look up the indications, drug interactions, dosing guidelines, contraindications, references, and so on. It's a fabulous tool for you to start using, especially if you use supplements in your practice, and it's totally free. So I recommend that you look this up and bookmark it and check it out after today's program. Okay, so if you're wondering if you're in the right place, you are in the right place if you're a physician or you're a health practitioner who's tired of prescribing trazodone, Ambien, or benzos, and you want more tools to support your patients with sleep. You're also in the right place if you are maybe starting to dread appointments, calls, or messages from patients with insomnia, and you'd love to have a sleep doctor in your back pocket. And you're also in the right place if you're already teaching your patients sleep hygiene, or maybe you're doing CBTI or referring them for CBTI, which is cognitive behavioral therapy for insomnia, but maybe it's not working or they're not following through. Let me know in the chat, which one are you? Are you number 1, tired of prescribing meds? Are you number 2, are you starting to dread appointments and you want more support? Are you number 3, or using behavioral tools that aren't working? Let me know in the chat which one of these, or it could be more than one, if any of these resonate with you. And I'll wait a moment while everyone responds. I see some number 2s, number 1, 1 and 3, more number 1s, number 3. Yes, kind of all over the board. And it's really interesting because that's sort of the response that I often get from people during this talk. So by the end of this, you'll have some tools to help you address any of those issues. And whatever your motivation is for being here, I'm really grateful that we're able to spend this time together today. So if we have not met, I'm Dr. Nishi Bhopal. I am originally from Canada. I'm from Vancouver, BC. I now live in the Bay Area, California, and I'm board certified in sleep medicine and psychiatry. I also practice through an integrative holistic lens. I'm the founder of Pacific Integrative Psychiatry, We're an online telehealth practice seeing patients all across California. And I'm the creator of IntraBalance, which is a sleep education platform for physicians, therapists, and other health practitioners. And I have a YouTube channel teaching sleep medicine and online courses, which we're going to look at the end of today's talk. And I'm also on faculty for a few different programs where I teach their sleep medicine modules. I've been featured in some of these places, so you may have seen me in some of these platforms. And I wanted to share a quick story about why I'm so passionate about teaching practitioners about sleep. And there was this one patient that sort of really sparked this journey for me to go into this online education space. It's never something that I thought I would do, but I saw this patient. His name is Adam. He was a 19-year-old kid that I saw in the sleep clinic, and I was covering for another doctor that day. And so Adam came in for his Ambien refill. And immediately that raised a red flag for me. Like, why is this young, healthy kid who's 19 on Ambien? And he had been on it for a couple of years at that point. So I immediately went and did a detailed history to figure out what the heck is going on with this kid. And it turned out he didn't have insomnia. He had been diagnosed with sleep onset insomnia and prescribed Ambien. Can you guess what the diagnosis was? Let me know in the chat what you think the actual diagnosis was. So he'd been prescribed this medication, this potentially risky treatment. And when I talked to him about the actual diagnosis and the fact that he didn't need medication for that, we were able to taper off, create a more holistic plan for him. He was so relieved. He was so happy that he didn't have to rely on this medication any longer. And so that highlighted to me that there's a gap. There's a gap in our education as physicians, as clinicians. Most doctors only get about 2 hours of sleep education in medical school, but all of our patients have to sleep. And this was even in a sleep clinic, right? So there was a huge gap there. And so that sort of prompted me to start thinking about filling that gap in whatever way that I could. And I see some responses here: ADHD, thyroid issues, some anxiety. Great guesses. So he had delayed sleep phase syndrome, which often looks like sleep onset insomnia. And we're going to talk about that a little bit today when we get to the melatonin portion of this talk. So imagine what it would feel like to transform your patients' lives while also growing your practice, improving outcomes, and then reigniting your passion for clinical work. So I believe that mastering sleep medicine is the key to enhancing your patients' outcomes. It empowers you to offer cutting-edge care. People are looking for support with sleep, so it'll set your practice apart. And you'll also address one of the most critical and overlooked aspects of health, which is sleep medicine, which, as I was saying, most of us get very little training in, even though every single one of our patients and clients has to sleep. So here's where we're going today. We're going to look at how to think about using supplements in your clinical practice. We're going to discuss 5 specific sleep supplements, including their dosing and evidence. These are melatonin, lavender, magnesium, L-theanine, and ashwagandha. And then at the end, I'll tell you about the Clinical Sleep Kit program, which is my online program for clinicians, and we'll move into a live Q&A. Okay, so let's jump in. We're going to look at how to think about using supplements in your clinical practice. So when I'm talking about supplements, there's really 6 main categories that I'm referring to. These are vitamins, things like your vitamin C, vitamin D, minerals like calcium and magnesium, herbs and botanicals like ashwagandha, which we're going to look at today, probiotics, amino acids, including L-theanine, which we're going to look at as well, and then enzymes like digestive enzymes. So tell me in the chat, are any of you already using supplements in your clinical practice, whether it's for sleep or for other reasons? Let me know. Just type yes or no if you're already using them. Anyone using supplements? I see some yeses. Lots of yeses. Okay. Fabulous. Okay, so whether or not you're using supplements, they're relevant, right? Because our patients are taking them. 3 in 5 adults in the US use some form of dietary supplement. Online, I'm seeing a growing mistrust of the medical profession and the medical community, and this is driving people towards more complementary and alternative treatments. Are any of you seeing this? I'm seeing this all over social media, YouTube comments, Instagram, a lot of mistrust of medicine. Let me know in the chat if you guys are seeing this as well. Sleep supplements are also a big business. It's about a $7.6 billion industry. So we need to understand supplements because our patients are taking them. but they're not without risks, right? So what I tell patients is that just because something is quote unquote natural, it doesn't mean that it's safe. There can be drug interactions. For example, I had a patient who came in who was on an SSRI and she added in rhodiola, not realizing there's an interaction there. She was feeling more anxious and activated. There can be contraindications and adverse effects. Patients may start using supplements in place of appropriate treatments. For example, a patient with sleep issues might think, I'm just going to take this melatonin instead of getting an evaluation when they may have sleep apnea underlying it. And I see some comments here saying, yep, you guys are seeing this sort of mistrust on social media as well. And I see a comment from Robert, a lot of hate towards experts in general. Yeah, I'm absolutely seeing that as well. So that's why we need to have this knowledge. So tell me in the chat, did you learn about using supplements during your clinical training? Was that part of your curriculum, or is it something that you've been learning on your own? Let me know in the chat. For me, I really didn't learn much about supplements at all. So I did my psychiatry residency in Detroit, Michigan. I saw there was someone from Detroit at Henry Ford Hospital. I did my sleep fellowship at Harvard and didn't really learn about supplements other than a little bit about, using vitamin D for deficiencies and things like this. And so I'm seeing some comments here, some yeses, some no's a little bit, but not enough. Learning on your own. Yeah, that's what I did as well. A lot of it was learning on my own and taking integrative medicine and functional medicine courses. Okay. So the AMA came out with a policy in 2020. This is the American Medical Association, saying that physicians should be asking about our patients' use of supplements. We should be talking to them about the risks, and we should remind them to tell us whenever they start or stop something and let us know if they're having any side effects. So again, I like to make sure my clinical practice is streamlined, and I'm not trying to add on more work into my practice. So what I've done is I keep a running supplements list under the meds list in the patient's chart. And I ask my patients about supplements every time I meet with them. So now they're trained. They're used to coming in with an updated list of their supplements. They know to come in with the brands that they're taking and the doses and so on. So it's just a nice, quick way that you can keep things up to date in your chart. So with regard to supplements, they are just that. They are not a replacement for a healthy lifestyle, for sleep-promoting behaviors. They're not a magic bullet, right? So the psychoeducation piece is really important when it comes to sleep, because oftentimes patients will look for that magic bullet, like, oh, if I just take the right type of magnesium or I just get the right melatonin supplement, I'm going to be able to sleep. And it just doesn't work that way. But we're using them as part of a holistic treatment plan. And there's three main buckets that I think about when it comes to supplements. These are using them for prevention. So for example, in pregnancy, using folic acid. We use them for repletion. So for example, if someone has an iron deficiency, we may add in some iron supplementation. And that's particularly relevant to sleep. And then we may be using it as a therapeutic for its calming effects. So we're going to look at this as we move through the talk. Now, some considerations here are that the FDA does not have the authority to approve dietary supplements for safety or labeling, which means that companies can introduce new products to the market without notifying the FDA. So quality matters. And I won't go through this whole slide here, but we want to look for third-party tested supplements. And later, when we get to the melatonin section, you'll see why this is particularly relevant. And we're on the Fullscript platform today. And so Fullscript is a tool that I've been using in my practice for years. And again, it's one of these things that just makes things easier for me in my practice. And it's a wonderful tool to recommend supplements to patients, folate. Yes, thank you, Carol, for the correction. So it's a wonderful tool that you can use to recommend supplements to patients, to send them handouts. There's other resources as well. And so there's a link there if you want to check it out. Okay, so let's move into the supplements themselves. So we're going to look at these 5 supplements. Now, any one of these could be a full series of webinars on its own, right? So we're not going to have time to go into detail in every single one of them. So we're going to look at these at a high level. But by the end of this, my hope is that you'll be able to think a little bit more strategically about how you want to use these supplements in your practice. And as we go through, if any of you have experience with these, if you have clinical pearls and insights, please share those in the chat so we can all learn from one another. Okay, so let's jump into melatonin. Are any of your patients taking melatonin? Let me know in the chat. I know a lot of my patients take it. Many of them will start taking it on their own, but many of them will ask me about it as well. So I see lots of yeses, some no's, mostly yeses, a few no's. I've had a few that were tons. Okay. So let's look at it. So as we go through this, let's think about our patient Steve. Steve is a 55-year-old male. He's got sleep maintenance insomnia, and he comes to you and says, I've been thinking about taking melatonin. What do you think? Do you recommend it? So let's think about Steve as we go through the melatonin section. Now, melatonin is the fourth most popular natural product taken by adults in the US. It's the second most popular natural product used by kids in the US, which I thought that was a pretty astounding statistic. The United States is the largest market for over-the-counter melatonin. And you may be surprised to know, or maybe not, that melatonin is available by prescription only in certain regions like Australia, the UK, Japan, and the EU. Was that surprising to anyone? Let me know in the chat if you were surprised by that or if you already knew that. Now, in those regions, it is available by prescription only because it's considered a pharmaceutical, essentially. Now, in the UK and Australia, it is indicated for adults over the age of 55 for insomnia because of reduced secretion of melatonin with age. So it's prescribed at a dose of 2 milligrams, extended release, in a form called Circadin. It's also indicated for kids with autism, ADHD, and other neurological conditions. And patients are required to have an evaluation every 6 months for ongoing use. I see some people already knew that, and to others it was surprising. Yeah. Now, how many of you hear this from your patients? Melatonin doesn't work for me. Have you ever heard that from people? I know I've heard that from patients, and as a sleep doctor, as a psychiatrist, I use melatonin quite frequently, strategically. And sometimes when I bring it up to patients as a suggestion, they'll say, no, I did that. It didn't work. Have any of you heard that as well? Many times, yes, often, yes. Okay, so why might that be? Well, one of the reasons is because it could be a quality issue, could also be a strategy issue, which we're going to look at. Okay, so as far as quality, did any of you guys see this study? This was from the Journal of Clinical Sleep Medicine in 2017. And they were looking at the melatonin content in 31 melatonin supplements that were purchased over the counter in Guelph, Ontario, in Canada. And they were looking to see what was actually in those supplements. Did any of you see this study? Let me know in the chat if you saw it. Okay, so here's what they found. In this sample of melatonin supplements, they contained anywhere from negative 83% to 478% of what it said on the label. Kind of scary, right? 70% of the bottles had melatonin concentrations less than 10% of what it said on the label. 25% of the bottles contained serotonin, some at significant doses. And there was 465% variability between lots of the same product. I thought this was pretty alarming. And I see many of you are sharing, didn't see the study, right? Like, it's pretty scary. Okay, let's look at this one. This was in 2023 in JAMA, the Journal of the American Medical Association. Did any of you see this? Let me know in the chat. In this one, they were looking at melatonin gummies. And so researchers ordered 30 different brands. They analyzed 25 of them. These are gummies. So here's what they found. One of them contained 31 milligrams of CBD and no melatonin in a melatonin gummy. Okay. 88% of the bottles were inaccurately labeled. Only 3 of the products contained within 10% of the amount of melatonin it said on the label. And then within this sample, the range of melatonin that was actually in the bottles ranged from 74% to 347% of what was indicated on the label. Okay, so again, pretty alarming. These are just like over-the-counter stores where they're getting them from. And who usually takes gummies? Kids, right? So gummies are often given to children. And with melatonin being the second most popular natural product taken by kids in the US, this is pretty scary. My colleague, Dr. Funke Afolabi-Brown, she's a pediatric sleep expert. She's spoken a lot about this. She was really alarmed when she saw this study come out. She's one of the experts inside of my clinical sleep kit training program, but she's somebody to follow if you want to learn more about pediatric sleep medicine. Okay, so melatonin is a huge topic. If you decide to join my program, then you'll get access to our melatonin mini training where we go deep into all of these different aspects of melatonin. So you get access to that right away if you decide to join. Okay, so what does melatonin do? Often we think about it in terms of sleep, and patients are usually thinking about it in terms of sleep, but it does much more than that. Melatonin's fascinating. We're learning so much more about all its different effects, its antioxidant effects, its anti-inflammatory effects. It's used for different indications. Today, we're focused on sleep primarily, though. It is a hormone, and it's the major chronobiotic that regulates the circadian rhythm. So it regulates the sleep-wake cycle. And this is how I talk to patients about it, that it's not really a sleep aid, it's not a sedative, but it's regulating your body clock. Now, it's not actually indicated for managing chronic insomnia. And these are recommendations by the American Academy of Sleep Medicine. It is indicated for circadian rhythm disorders, as you can see listed there. It's also used for REM sleep behavior disorder. And it's also indicated in pediatrics for kids with autism, ADHD, irregular sleep-wake disorders, and neurological conditions. Now, how I use it, I don't work with kids in my practice, I work with adults. So I use it a lot for circadian rhythm issues. Using it strategically at a low dose is how it's most effective, and we'll look at that in a moment. And there's a whole training with Dr. Sarah Silverman. She's one of our experts inside the program. She is a circadian rhythm expert. She's a sleep psychologist. So she has a mini training on how to use melatonin at a micro dose to shift the body clock. Okay, so not all of our patients are going to have circadian rhythm disorders, though, right? So there's other ways that we can use melatonin, even though it's not indicated for chronic insomnia. So we talked about in the UK and Australia, it's used in this extended release form at about 2 milligrams for adults over the age of 55 for, for sleep support, really, because of reduced secretion of melatonin with age. There's also research going into its use in menopause. There was a study showing that 3 milligrams for 3 months could be helpful in menopause. Certain medications can actually inhibit secretion of melatonin, including beta blockers and fluoxetine. So in my practice, I see lots of patients who are taking these kinds of meds. So we might use it actually as a repletion strategy in those patients. How I use it most commonly, though, as a psychiatrist, I'm seeing lots of patients with anxiety and depression and comorbid sleep issues. And what I do find is that many of these patients have a little bit of a loose body clock, right? So it might not be, it might not fit into the criteria of a circadian rhythm disorder, but their body clock is a little bit irregular. And so I'll use melatonin to kind of sync up their body clock, to kind of reset it at a low dose for a few weeks. And I do find that it does work nicely in combination with magnesium and L-theanine. Now, that's just anecdotal based on my clinical practice, something that I find helpful. If there's anything that you find helpful, please share in the comments. I'd love to learn. Some dosing strategies. So I say less is more, maybe, because I mentioned those other indications. It's antioxidant, anti-inflammatory effects, and so on. Those are different dosing strategies that are used for, cancer, that are used for sepsis and other types of conditions. But for sleep, we're usually using doses of about 0.3 to 3 milligrams. And then you can see some general guidelines here. There's actually no consensus on melatonin dosing, but these are some guidelines that can be helpful. The other question I get a lot is, what time should I take it? So this is going to be personalized to the patient. It's going to depend on their sleep schedule, their circadian rhythm, the indication, of course, why you're using it. Generally, for most people, 1 or 2 hours before bed is what's helpful. There is a strategy to dose it earlier in the evening if you're trying to advance their circadian rhythm, or you're trying to pull their body clock earlier and get them to sleep earlier. And so there is a strategy around that as well. But for most people, an hour or two before bed can be helpful. Okay, remember Steve. So let's talk about him again. So Steve is our 55-year-old male. He's got sleep maintenance insomnia. He comes to you and says, I heard about melatonin. Do you think I should take it? Well, the first thing I'm thinking about in a patient like this is what's going on, what's causing the sleep maintenance insomnia. I'm thinking about sleep apnea, obstructive sleep apnea, which is OSA, as you see listed there. Other sleep disorders, other medical issues contributing to this. So we want to address those. We're not going to use a supplement in isolation. It's going to be part of a whole integrative plan. Now, in someone like him at his age, maybe a sustained release, 1 or 2 milligrams would be helpful. He can take it an hour or two before bed for a few months, but maybe for ongoing use if he's on a melatonin depleting drug like a beta blocker or fluoxetine. Of course, we want to address other factors, so lifestyles. We want to implement sleep promoting behaviors. And I teach all of my patients principles of CBTI, which is cognitive behavioral therapy for insomnia, including principles of stimulus control and sleep restriction. So all of my patients learn this, and we do it in a way that's really easy for them to understand, and that's effective. And my patients, they know how to do it on their own after a while. And so if you join the program, you'll get to learn how to do that as well. And I see a question about side effects like vivid dreams and nightmares. That is a side effect to look out for. Yes, absolutely. Let's move along in the interest of time to lavender. Are any of you using lavender in your practice? Let me know in the comments. I see some yeses, some nos. More yeses, some mixed. Okay, very good. So let's think about our patient, Jamila, as we move through this section. Jamila is a 45-year-old woman with anxiety, depression. She's got some mild sleep onset and sleep maintenance issues. And she comes to you and she says, my PCP gave me Ativan or lorazepam. I don't really want to take meds. What do you recommend? Okay, so let's think about Jamila as we look at lavender. So lavender has been used for centuries. It's been used to treat anxiety, depression, sleep issues, and other conditions. And it comes in 4 main forms. Aromatherapy, and I see Natasha saying you have a lavender diffuser in your office. Yeah, beautiful. So it's used as aromatherapy. I see Elizabeth uses it as an essential oil. Absolutely. So you can use it topically. It can be taken orally, which we're going to look at, or brewed into a tea. So lavender is shown to have antioxidant effects. It's shown to help reduce blood pressure and heart rate. There are clinical trials with oral lavender that have shown improvements in depression and anxiety. And in terms of sleep, there are studies that show that lavender improves sleep quality, reduces sleep disturbances, and it may enhance deep, slow-wave sleep. Okay, so do any of you get messages like this from your patients who will call you or leave a message in the portal saying, I'm really anxious, I just need something for anxiety? Do you ever get messages like this? And if so, you usually know what they're asking for, right? They're usually asking for some type of a benzo. They may be asking for Ativan or Xanax or Valium or something like this. So I know that I get questions like this often from patients. So lavender could be an option in some of those patients. Okay, so there's quite a few studies on lavender. I'm not going to go into all of them, but I've got a couple of them highlighted there. So if you want to take a look at those referenced later, you can take a deeper dive into the studies. So there was a trial that looked at the benzodiazepine lorazepam or Ativan and the lavender extract silexin. So silexin is the oral form of lavender. And they found that they had similar improvements in anxiety symptoms. There was another large trial looking at silexin, so that oral preparation of lavender, and it significantly reduced anxiety compared to placebo. They also looked at paroxetine or Paxil, which is an SSRI, and they found that that had actually less of an impact on anxiety compared to the silexin, which is kind of interesting. And they found that the silexin was well tolerated with fewer side effects compared to the paroxetine. There was also a meta-analysis that showed silexin effectively reduced anxiety and improved sleep, and also improved quality of life in patients with mild anxiety, and they found it was well tolerated. So some interesting data there. So you can take a look at those studies. So this you can consider in patients with anxiety disorders, or if they have sleep-related anxiety, or if they're experiencing depression. Now, the beneficial effects of silexin on sleep are thought to be because of the reduction in anxiety levels, not because it's a sedative, but more because it's helping people feel less anxious, which then in turn can help with sleep. Some dosing guidelines, it comes in 80 milligrams or 160 milligrams when used orally. Aromatherapy is also effective, and I know some of you are using it in that form. So with that, you want to make sure it's a pure essential oil, not a synthetic fragrance, because there's compounds in the essential oil that have the therapeutic effects, and you want to make sure it's being used in a well-ventilated room, and then it can be used topically as well. And here's some adverse effects to look out for. So lavender burps, when used orally. I actually had a patient who was from France, and she quite enjoyed that lavender aftertaste, so it's not necessarily distressing to everybody. It can cause some GI upset, some skin sensitivity if used topically. Now, lavender does have weak estrogenic effects, so it's not recommended for patients who have hormone-sensitive cancers. There's also been case reports of excessive breast development in preteen boys and in preteen girls with application of lavender, so just be careful with those populations. Back to Jamila. So she's our 45-year-old woman with anxiety, depression. She's got some sleep onset and sleep maintenance issues. And she didn't want to take the lorazepam or Ativan that her primary care had prescribed. So she asked, what else can I do? So with this patient, we actually did, so this is a real patient of mine. So we actually did oral lavender, 80 milligrams, and she just takes it as needed. And she found that that was kind of helpful for those days where she felt a bit more anxious. Now, of course, I'm not just sending them home with a supplement and that's it. We're using this as part of a whole plan. So with her, we worked on relaxation techniques. We work on cognitive reframing, some mild sleep restriction or sleep compression, which you'll learn how to do if you decide to join the program. Teach that to all of my patients. And so the lavender was a nice adjunct to all of these other interventions. Okay, I'm going to keep moving along. I know there's questions. I'm going to keep moving along in the interest of time so we can get through everything. Who is using magnesium? Let me know in the chat if you're using magnesium in your practice. Magnesium is one that I use pretty frequently. See lots of yeses. Yes, love it. Okay, good. Lots of yeses. All right. Okay, so we're going to think about Diane as we look at magnesium. Diane is a 60-year-old woman. She's got muscle tension, anxiety. She's got sleep onset insomnia. And she comes to you and says, my friend told me I should take magnesium. What do you recommend? Okay, so let's look at this. Magnesium is the second most abundant mineral in the human body. It's a cofactor for hundreds of enzymatic reactions. It helps to modulate GABA, which is an inhibitory neurotransmitter, so it's calming to the nervous system. There's also some data suggesting that magnesium supplementation can decrease the concentration of serum cortisol. Now, magnesium is all over social media. Are you guys seeing this? Oh, looks like my connection was cutting in and out. Are you all able to still hear and see me? Just let me know in the chat. Okay, I think we're good. All right, so are you seeing this on, okay, thank you. Are you seeing this on social media as well, where lots of people are talking about magnesium, right? There's even big name influencers who have their own sleep supplement protocols that contain magnesium. Okay, see lots of yeses, yeah. So I'm getting questions about magnesium all the time from patients. So here's the thing though, with regard to magnesium and sleep, the data is not as robust as you might think. Now, that doesn't mean I don't think that it's useful. In fact, I have most of my patients on some form of magnesium and I take it myself. But let's look at sleep. So there's actually limited data on the use of magnesium in sleep. There are some short-term randomized controlled trials in older adults that had mixed findings on the association of magnesium supplementation with sleep quality. There was a clinical trial looking at 500 milligrams of magnesium for 8 weeks, showing that it improved sleep duration and decreased sleep latency, which is the time to fall asleep, in older adults. There was a systematic review in the journal Sleep in 2022, showing that people who had a higher intake of magnesium were more likely to get the recommended amount of sleep. Now, what that means needs to be understood further, but you can take a look at the study there. I've got the reference at the bottom. So magnesium, you can consider this in patients over the age of 55, in patients with anxiety, depression, muscle tension, migraine headaches, those who are taking proton pump inhibitors, type 2 diabetes, patients taking diuretics. So this probably covers the vast majority of the people that you're working with, right? So it's such a critical nutrient that I have a pretty low threshold for recommending it. And I tell patients that, like the data on it for sleep is still pretty limited. It's not something that you're going to take and it's going to, magically improve your sleep, but it's working in the background and it's involved in so many, physiological processes that it's worth supplementing with. And most of us aren't getting enough in our diet. So it comes in lots of different forms. There's just 3 ones that I've shown you here, but there's other ones as well. Magnesium citrate has laxative effects, so you can consider it in your patients with constipation. Magnesium glycinate is usually a bit more neutral to the GI tract. Magnesium threonate may be more helpful in people with anxiety and ADHD. Most of my folks are on magnesium glycinate, but sometimes I'll use the other ones depending on what's going on with them. And you can start low, go slow. That's kind of a good rule of thumb. So around 150 to 200 milligrams, you can titrate. And look out for side effects at higher doses, usually more GI issues. And I know a lot of you are using magnesium, so if you have any clinical pearls to share, please drop those in the comments. Okay, so back to Diane. She's our 60-year-old woman with muscle tension, anxiety, sleep onset insomnia. And so she has GI issues. She's prone to loose stools. So I'm going to stay away from magnesium citrate. We actually do magnesium glycinate, and she tolerates that really well. And again, we're not just throwing on a supplement and leaving it at that. It's part of a holistic plan. So for her muscle tension, her anxiety, her insomnia, I like to create sort of a bedtime menu for patients. I'm not a huge fan of bedtime rituals or sleep rituals at night because it starts to create a bit more rigidity for people, because if they feel like, oh, I didn't get all the steps in for my 5-step ritual I have to do to go to sleep, it actually creates more anxiety. So I like the idea of creating a bedtime menu where maybe there's 7 to 10 items that they write down on their menu, and each day they can pick a couple of things that they want to do that help them unwind. So on this patient's bedtime menu, she loves taking baths. So I had her add Epsom salts to her baths. So that's magnesium sulfate. She does that a few times a week, and she finds it really relaxing and calming. And then she gets a bit of magnesium that way as well. And I see Rebecca's commenting, you recommend it 3 to 4 times a day. You can get more in. Great. Okay, L-theanine. Who's using this? Let me know in the comments. Are you using this in your practice? Anybody using L-theanine? Lots of yeses, some nos. Yes, love it. Definitely. Great. Okay, so let's think about Susie. So Susie is our 34-year-old woman with anxiety, PTSD. She's got sleep onset insomnia and some anxiety about going to sleep, so some sleep-related anxiety. And she comes to you and she says, I want to take something for sleep that's natural. What do you recommend? So let's think about Susie as we go through this portion. Okay, so L-theanine, it's an amino acid. It's found in certain types of tea and mushrooms. And a cup of tea contains about 50 milligrams of L-theanine. It is shown to promote a sense of calm, reducing stress, and reducing anxiety without causing sedation. And what's really interesting is that it can help with cognition and focus without being sedating. So that's an interesting feature of L-theanine. It's thought to increase alpha brainwaves, which you see during states of meditation or wakeful relaxation. It modulates neurotransmitters like GABA, serotonin, and dopamine. It reduces glutamate, which is excitatory. And in terms of sleep, it may help people fall asleep more quickly, so reduces their sleep latency, and it may improve sleep quality. Now, some data on L-theanine. Like lavender, it helps to promote good sleep by reducing anxiety. So it itself is not a sedative, but it helps people feel more calm and less anxious, and that then helps improve their sleep. There's a study here, you can see the reference showing that it may improve sleep efficiency in children with ADHD. And in adults, it may improve subjective sleep quality in patients with generalized anxiety disorder. And you can see that reference there as well. So L-theanine can be considered in patients with anxiety disorders, with sleep-related anxiety, and then patients with ADHD. I'm curious, for those of you who are using it, do you use it more for anxiety, for sleep, for ADHD, or something else? Let me know. Curious to hear your experiences. As far as dosing, sometimes patients will ask me like, well, can I just drink some green tea and get my L-theanine that way? When it comes to sleep, I'm usually not recommending that because of caffeine content. So they can take purified L-theanine as a dietary supplement. And I'm seeing lots of people are using it for anxiety and sleep. Yeah, monkey mind. Yeah, that's how I use it as well, mostly for anxiety and sleep. And yes, the tea. Yeah. So the tea I usually don't recommend because of caffeine content. And also it's only about 50 milligrams in a cup of green tea, which may be helpful for some people, but I do find that most people need a bit of a higher dose. So you can get a dietary supplement. Usually they come in 100 or 200 milligram capsules. And I'm generally starting with around 200 or 400 milligrams at bedtime, about an hour or so before bed, working within a max dose range of about 1,200 milligrams a day. It's pretty well tolerated. I haven't seen a ton of side effects with it. If any of you have seen side effects, please share. But I find that it's really well tolerated. The biggest complaint I get from people is that they tried it and they felt like it didn't do anything. And that's usually because it's underdosed. So in those cases, I might bump it up to 400 milligrams twice a day, especially if they have a lot of anxiety. And I do find, again, anecdotally, that they can combine it with magnesium. Yeah, so someone's asking split doses. Yeah, some people have seen extreme sedation. Yeah, I've actually seen. So personally, like if I take 200 milligrams, I'm going to be sleepy. Like even though it's not meant to be sedating, that's just my response to it. So it's an important point just to remember everyone responds differently. So I like to start low, go slow, and just gauge the person's response before we start pushing to a higher dose. So back to Susie. She's our 34-year-old woman with anxiety. She's got PTSD, sleep onset insomnia. And she asks you, well, is there something natural I can take? So again, we're not just throwing a supplement at it and sending her on her way. So she actually responds well to a bit of a higher dose. So 200 milligrams in the morning, 400 milligrams at bedtime. She feels like that kind of works really nicely for her. And she can even self-titrate if she's experiencing a period of stress within that max dose range. But again, that's not the only thing. This is just an adjunct. The core of what we're working on is self-compassion. She really responds well to that. Working on coping skills. I teach all of my patients sleep restriction, principles of CBTI. So you'll learn that if you decide to join the program. And I use the DARE app for anxiety, which is a great app for anxiety and panic attacks. And I'm actually on their board of advisors, but I love their app. It's just super, super helpful. So she responds well to that as well. And I see another comment, I can only handle 100 milligrams. Yeah. So, everyone's different. Okay, ashwagandha. I think we're doing well on time. Let's keep moving along. Do any of you use this in your practice? Let me know in the comments. Do you use ashwagandha? And I know it comes in a lot of different blends. It can be used on its own. I see some yeses, lots of yeses. Okay. Consistently. Wonderful. I see some no's. Okay. Great. Okay, so let's think about Joseph as we go through this. So Joseph is our 38-year-old male. He's got high pressure job, right? So he's stressed out. He's traveling all over the world for his job. He's going to Europe. He's going to Asia. So he's got lots of circadian rhythm issues, irregular sleep schedule from travel. On top of that, he has anxiety. He has insomnia. He's fatigued. He's burned out. So he comes to you and says, Doc, I'm tired all the time, but I just can't sleep. Should I just take Ambien? What do you recommend? Okay, so let's think about Joseph as we look at this. Ashwagandha is an Ayurvedic herb that's been used for thousands of years. If you're not familiar, Ayurveda is the traditional system of healing from India. It's over 5,000 years old. And the scientific name for ashwagandha actually means sleep inducer in Latin. So it's been used for lots of different things. It has anti-inflammatory effects, anti-cancer effects, anti-stress, and so on. You can see all the different indications that it's used for here. So pain, inflammation, cognitive disorders, stress, physical performance, and so on. So like lavender, there's quite a number of studies on ashwagandha, and I'm just highlighting one of them here. The reference is there at the bottom. This was a systematic review and meta-analysis from 2021. And they did a meta-analysis of 5 trials that found a clinically beneficial effect of ashwagandha extract on sleep. And the improvements were more prominent in adults who had been diagnosed with insomnia and they were treated at a dose of at least 600 milligrams daily for at least 8 weeks. And on top of that, they found there was improved mental alertness upon rising. Not surprising, right? If you sleep better, you're going to feel more alert when you wake up, and reduced anxiety levels during the day. So this you can consider in patients with, think about your burned out patient, right? So they're fatigued, they have brain fog, but they're also stressed out. They're anxious, they have insomnia, they can't sleep. That wired but tired sort of patient. Those of you who are using it, are there any specific indications that you like to use it for? Please share in the comments. And some tips for dosing. So it comes in different forms: capsules, powders, tinctures, tablets. You want to choose a formulation that's made from the root extract, which contains the highest concentration of the active ingredient, the withanides. It should be taken for at least 8 weeks in order to work. So that's just a little pearl. I'll have patients tell me that, I took it for a week or two, didn't do much. Well, they really need to take it for like 6 to 8 weeks for it to start to have an impact. And you can start with around 300 milligrams twice a day. And I see many of you are using it for adrenal dysfunction, anxiety, sleep, stress, that wired but tired. If you have any particular dosing strategies that you like, please share those as well. I always love learning from others. Okay, so some side effects and precautions. It's usually well tolerated, but it does have, it can increase testosterone. So you want to avoid it in patients who are taking hormone sensitive or who have hormone sensitive prostate cancer. Use caution in patients who are taking these sedative medications, so benzodiazepines, anticonvulsants, etc. It is from the nightshade family of plants, so you want to avoid it if patients have allergies or sensitivities to nightshades. And also be careful with other medications like medications for diabetes, high blood pressure. So you want to do a full medical eval to make sure that that ashwagandha is appropriate for them. So back to Joseph. He's our 38-year-old male, traveling all over the world. He's stressed, burned out, fatigued. He can't sleep. So again, we're not just using supplements in isolation, not just giving him an ashwagandha and that's it. So he responds really well to just a low dose, 300 milligrams, and he does notice a difference with that dose. And we work a lot on self-care, on boundaries, and for his jet lag, we use the Time Shifter app, which is a great app for people who are traveling across time zones. So he finds that really helpful just to prepare for his international travel and to minimize the effects of jet lag. Okay, so if you're integrating supplements into your clinical practice, you want to consider the evidence base. You want to consider drug interactions or their other medical conditions. You want to take into account your patient's values, their priorities, their beliefs, like our patient Jamila, who just didn't want to do pharmaceuticals, so she preferred to try the lavender. Of course, you want to work within your scope of practice and then get informed consent. So we have just scratched the surface of the herbs and botanicals, right? So just a really quick introduction, but hopefully you have some takeaways about how to think about these in your practice. And there's all these other aspects of integrative sleep medicine, which of course we don't have time for today in a short talk. So sleep hygiene, CBTI or cognitive behavioral therapy for insomnia, sleep testing, understanding when to do a sleep study, how to interpret them, what does it mean, what types of sleep studies do you need to order, working on nervous system regulation, the role of nutrition and gut health, circadian regulation, also helping your patients connect with their sense of values and purpose in life. And then pharmacology plays a role in how do you use that strategically? How do you taper off medications while supporting your patients with sleep? So there's all of these different aspects, of course, that we didn't have time to get to, but we do cover in the program. So if you would like to learn to help your patients sleep better and acquire the tools, skills, and knowledge to transform your practice, I would love to invite you. So we have two options at this point. So to continue to piecemeal education together on your own, which I know many of us do, especially at the beginning, we talked about how we learn to do that. We learn supplements on our own, or we can learn together with experts. And it's a much faster way to do it. So I'd love to invite you into the Clinical Sleep Kit program. This is essentially the type of program that I wish that I had when I finished my sleep medicine fellowship, and now I'm embarking on this journey. So this is a program for outpatient physicians and health professionals. The Clinical Sleep Kit, or CSK for short, is the only resource of its kind that teaches you how to work up and treat patients with sleep issues so that, the goal is to improve patient outcomes, right? And avoid patients being put on Ambien, like our patient Adam that we talked about at the beginning, to also increase your professional satisfaction and grow your clinical practice without having to take the time off to go and do a sleep fellowship. Here's what you'll put into action in the program. So you'll learn how to work up any patient with sleep issues and get the right diagnosis. So you'll identify the differential diagnosis. You'll use frameworks to systematically do that. It'll help you reduce prescriptions for sedative hypnotics, or if you're not a prescribing clinician, you'll learn how to help your patient advocate for reducing those and support them along the way. You'll learn how to implement those principles of CBTI that we had talked about, create a streamlined intake process for your practice. And the gem of this program is really that you get to consult with guest experts and a community of clinicians to discuss your cases so you can actually implement effectively all of the tools that you're learning. And you'll get to network with colleagues from around the globe and grow your practice, and you can refer patients to and clients to one another. And you'll learn how to have more effective conversations with your patients about sleep, about sleeping pills, about CBTI, how sleep works, and so much more. And by completing the core competencies in the program, you'll also be able to earn your sleep health certificate. So here's what's inside the program. We've got 3 pillars. Pillar 1 is self-guided training. Pillar 2 is our case discussion with guest experts. And then Pillar 3 is our private community. So put all together, this program could be a total value of, over $7,000 if you were putting all of that together. And so here's one of our students. She is Dr. Renee Drolet. She's a psychiatrist. And she went through the program, and she said that it's given her the confidence to address just about every sleep concern that she sees. She's got way more tools now beyond trazodone and melatonin. She has a more systematic and holistic approach to treating her patients' sleep issues. And she highly recommended the program and gave it 5 out of 5 stars. And so I want to make sure that the program is right for you. We don't want people just coming in and feeling like, oh, I signed up for this and it's not really what I was looking for. So you get a whole week to kind of poke around, which is plenty of time to come in, check it out, make sure it's the right fit for you. And then if you feel like it's not the right fit, just send us an email and we'll happily give you a refund, because I don't want people coming in and not being happy with it. But the majority of our people come in and they have wonderful things to say, and they learn so much. And so here's a little bit more about what you'll learn. So these are the different modules in the student portal. So we'll go over my 5T sleep method. So that's going to teach you how to work up those patients so you get the right diagnosis, how to implement a treatment plan. We'll go over sleep medicine foundations, sleep disorders and management, so different kinds of sleep disorders. We'll look at integrative therapies, including supplements and other things. We'll look at technology testing and labs, how to use wearables in practice, how to interpret sleep studies. We're doing more work on entrepreneurship and practice management, so you can learn how to grow your practice. We've got case conferences, product guides, and so much more. So I won't read all of these out. You can check out the registration page to see all what's in there. This is our private community. So we have this private community discussion board where you can talk to others in the program, and you can share knowledge, share resources, ask questions. Right now, as we speak, what's happening in the community is people are discussing supporting their patients with election-related insomnia, right? I know I'm seeing that in my practice. So there's a nice discussion happening on, like, how do we support our patients right now who are struggling with that? We've got guest experts every month. So you may be wondering, who are those experts? They are sleep doctors and sleep specialists from around the globe. So I mentioned Dr. Funke Afolabi-Brown. She's a pediatric sleep doctor. Dr. Valerie Cacho, she's an expert in perimenopause and menopausal sleep issues. Dr. Sarah Silverman, who you saw earlier, she's a circadian rhythm expert. Dr. Laura Barbier, she's a trauma and sleep expert, and so on. So we've got experts from all different arenas, so we can learn from their particular, areas of expertise. We have a monthly case conference so that you can come in and discuss your cases so that you can better support your patients, because you can get the knowledge, but implementing it is really the key. So that's what the case conference is for. Those are all recorded as well. And then if you complete the core competencies in the program, you can earn your sleep health certificate. So you must be wondering the cost. The cost is only $799 for the year, which is really, with all the value that you're getting, it's a really low introductory price. I just started this program last year, so that's why we're introducing it at a pretty low price for everything that you get. So it's $7.99 for 12 months. Or if you want to just do month to month, it's only $79. So pretty accessible. And you can go to intrabalance.com/register. You can see everything that's in the program, and then you can sign up from there. And doors are open now until next Friday, November 15th. And you can use the QR code if you want to check it out. Okay, so at the beginning of this class, I mentioned a special bonus that you would get if you stay till the end. So thank you so much for staying with me to the end. And so there's this bonus that we have if you sign up during this program before we end this call. If you sign up for the annual plan, you'll get free access to the Holistic Sleep Reset, which is a self-guided sleep program that I've put together based on principles of CBTI, Ayurveda, integrative medicine. And sells for $149. So you get that for free if you sign up as a thank you for joining the program. So that's available if you sign up before this call ends. This is Dr. Abhishek Rai. He is one of our psychiatrists in the program, and he was looking for more support for his patients struggling with sleep. And so he wanted to save time and find a reliable resource. And he always says to me, Nishi, I feel like I'm getting so much he's like, I feel like I'm stealing your content. Like, this is such a low price for everything that I'm getting. And he told me that he feels more confident in talking about sleep. And he wrote that it's one of the best programs to assist with learning sleep and supporting your patients. So this program is for you if you're tired of prescribing meds, you want to learn other things that you can do. If you're starting to dread those appointments or calls from patients saying they can't sleep and you want more support around that, you will learn how to do that in this program. Or if you're trying all the behavioral tools, you're trying sleep hygiene, you're trying CBTI, and it's just not working, you'll be able to get more support around that and learn more effective ways to support your patients. And you'll be able to also connect with like-minded colleagues and support your patients and grow your practice at the same time. So it's a lot of fun. We have a lovely, welcoming, loving, warm community. And so we'd love to welcome you in. And then if you're wondering about CME or CE credits, we've partnered with Learner Plus, which is a reflective learning platform. So anytime you learn something in the program, you just click the link that's in the program, and then they'll guide you through getting your educational credits. So that's all offered through Learner Plus. This is Dr. Kaisa Troutman. You can check out her video. Let's see, I'll put the registration link here in the chat if anyone wants to see. Okay, so you can check out Dr. Kaisa's video on that link that I just sent. So she's an obesity medicine doctor. She's also trained in CBTI. And so she did her CBTI certification and then thought, wait, how do I actually do this, implement this with my patients? So she joined the program to get that support for that practical application. And she says the program's been amazing and she recommends it without hesitation. So you can check out her video on the registration page. And then we've got Irina Makari. She's a sleep coach. She also has a video on the registration page if you want to take a look at what she had to say. So she's a sleep coach. She's been growing her practice. She actually just left her corporate job and is now focusing on her holistic sleep coaching practice full time. And she says this program's been a game changer for her because she gets the support, the knowledge, the training, the networking, and it's given her deep insights into sleep to enhance her practice with all the materials available. And so she highly recommends it as well. And I know we're coming up on time, so I'm just going to show you this. So I'd love to welcome you in. If you have any questions, feel free to reach out to me. You can go to intrabalance.com/register to check out the program. And we go deep into some of the topics that we touched on today. So just in time, I think I'll stop there and then we can, Sarah, if we have time for questions, we can do that.
Yeah, we have a few minutes left, so we'll try and get to as many questions as we can that came through. The first one is lots of focus on onset sleep disorders. What about middle of the night insomnia?
Yeah, great question. So middle of the night insomnia, there's a few things that I think about. So I'm always thinking about differential diagnosis, right? What's causing it? So the first thing I'm going to think about is sleep disordered breathing. Does the person have obstructive sleep apnea? The other things I'm thinking about are restless leg usually happens with sleep onset, but periodic limb movement. I'm thinking about hypoglycemia in the middle of the night. And then of course, anxiety, elevated cortisol, stress, panic. So I'm going through sort of that list in my mind. Sleep restriction is one of the most effective treatments, but we want to make sure that we're not missing the underlying diagnosis. So I'll go through those and then you're going to treat accordingly.
Great. The next question is L-theanine safe to use long-term?
Yeah, it's a good question. I think there's limited data on long-term use, so I'm continually reevaluating, every few months, does the patient still need it? So I like to put a start and stop date on things. I believe most of the studies have looked at up to 8 weeks. If anyone knows more, please correct me in the chat. But I try not to have people on things ongoing forever because we're just using the supplement as an adjunct while we implement all the other tools that we had touched on.
Perfect. Thank you. The next question is, what is your opinion on 5-HTP for sleep?
Yeah, 5-HTP can be really helpful, especially for patients who are struggling with anxiety and depression. Of course, you want to make sure that they're not on an SSRI or something else that's going to interact with it. But yep, can be helpful.
Okay, we'll try and get to 1 or 2 more. I know we're right at time, but we'll stay on a few minutes longer just to address as many as we can. Do you recommend cycling melatonin dosing?
Yeah, so with melatonin dosing, I'm usually not using it for more than 12 weeks at a time. And again, I'm going to have a start date, stop date, whole behavioral and integrative plan. And then oftentimes with patients with circadian rhythm issues, you can get them on track, take them off the melatonin, but they might start drifting again. So then I'll have them cycle back onto it. So yes, I do use a cycling strategy.
Perfect. The next question is, you mentioned that lavender shouldn't be used with hormone-sensitive cancers. Does that include prostate cancer?
Yeah, I'm really conservative when it comes to that. So if the patient has any type of cancer, I will consult with their oncologist just to make sure that it's safe for them. So yeah, I wouldn't use it, but that's, I'm extra conservative with those things.
The next question is, do any of these 5 supplements help with nocturia?
Yeah, good question. So with nocturia, again, the question is, what's causing it? And many times it's caused by some kind of sleep disordered breathing or obstructive sleep apnea. So I have a really low threshold for, I actually just saw a patient with nocturia who was referred to me a few days ago, and they haven't had a sleep study, but they've been trying all these different treatments for nocturia, getting all this expensive workup done. And so we're going to do a sleep study to make sure, because nocturia is a symptom of sleep apnea, or it can be.
The next question is, magnesium threonate is more expensive. If needed for sleep, is magnesium glycinate effective for sleep?
Yeah, I usually use magnesium glycinate for that reason. It's more cost effective and it works well. Again, with that caveat that the data on magnesium and sleep is kind of limited. So we're using it as part of a whole plan. But yes, magnesium glycinate can be helpful.
Okay, we're going to do 2 more. The next one is valerian roll.
Yeah, I don't use a lot of valerian. It can be helpful, but it may have similar issues as benzodiazepines. It works similarly, and I have had patients take valerian and then have withdrawals from it. So I usually kind of stay away from that one.
Perfect. And the last question, does taking melatonin supplements decrease the patient's own production of it and cause a negative feedback?
Yeah, that is the $1 million question, right? And I think the data on this keeps on changing. I know there was some thinking about that before. Short answer is, right now it's not known, probably not, but it is possible. It's a hormone, right? So again, I use that cycling strategy because I'm really conservative and I don't want that to be an ongoing issue for patients. However, I'll just add really quick, because I know we have to wrap. For those patients over the age of 55, or if they're on meds that deplete melatonin, I might just have them stay on it because we're using it as a repletion strategy.
Awesome. Well, thank you so much for your time today, for the wonderful presentation and addressing questions. As a reminder, we will be sharing a recording with everyone today. So if you got here late or want to rewatch it, you will be able to in the next few days. So just keep an eye on your inbox, and thank you for being here today with us.
Oh, thank you so much.